Hello, good day. I'm Dr. Evany Lambito Alisa de Pesa, and I will be sharing with you my experiences as a mother and why is it there are a lot of incidents nowadays with those who are experiencing postpartum depression. And as you can see, there are a lot of factors that can actually cause postpartum depression.
You have to know the risk factors for postpartum psychosis. So it will be primiparity, that means it can be because of the first pregnancy, discontinuation of mood stabilizers for those who are actually experiencing mood disorders, for example, bipolar disorder. So, obstetrical complications can also be one of the factors for postpartum psychosis. Infant mortality, previous bipolar episodes, psychosis or postpartum psychosis, or a family history of postpartum psychosis or bipolar disorder. Sleep deprivation is actually one of the factor of bipolar disorder. I have experienced actually firsthand how it can actually affect your behavior, your mood. You become more irritable, no? Palagi kang nagagalit or inhiligay, no? Parang kang pangakig. It's because of those lack of sleep. We actually at times take for granted that sleep is very important in mental health promotion. So, increased environmental stress can also be risk factor for postpartum psychosis, especially if it's the first pregnancy or even if it's multiple pregnancies. A lot of responsibilities at home can actually be aggravating factors for a risk factor for postpartum psychosis. If you also have lack support from your partner, which actually helps, especially if you have a supportive partner, no, you can take turns in with regards to taking care of the baby. If you become a mother, one of the thing that I really appreciate is my mother, because now being a mother, I appreciate more my mother, how she raised us, especially now I have a twin. So it's really difficult, even though during the time that I was only postpartum with Cepha Yvonne. I wake up in the first few months, I wake up every hour, every 2 hours, or just seldom every 3 hours. So I really don't have enough sleep, and it's really difficult for me, especially when it's the second month and I have to go back to work. Okay, these are actually risk factors for postpartum psychosis. Now we go to distinguishing peripartum depression from baby blues. Okay, so we have to know what is normal, what is it's already depression. So, kasi pag baby blues, it can be normal part of transition from being pregnant and then having a new baby in the house, and you have sleep deprivation and a lot of stress at times. Okay, so for baby blues, okay, for the duration, it's less than 10 days. For peripartum depression, it's more than 2 weeks. Okay, so watch my major depressive disorder or MDD lecture or depression lecture, so you can actually know what's the difference of major depressive disorder. So well, with regards to baby blues, no, it's the onset is within 2 to 3 days postpartum, prevalence 80%. So it's common usually during postpartum period, and severity mild dysfunction. Okay, you can go back to your having a good relationship or work or responsibilities, other responsibilities. Suicidal ideation is actually not present during baby blues. So you can feel sad, but it cannot actually make you dysfunctional at work or in your relationship. But if you are actually experiencing peripartum depression, as I have mentioned, it's more than 2 weeks, often within the first month. the onset of this, and the prevalence is not common. So 5% to 7%, but nowadays it actually increases. It can cause moderate to severe dysfunction, and suicidal ideation may be present. So if you know someone, if you're experiencing things like this, peripartum depression, it's really important that you seek help at ASAP, okay, as soon as possible, because if it cannot be relieved, you can actually have that severe depression with psychotic features, and we actually doesn't want you to experience that. So we want you to avoid the severe mental disorders that can happen during postpartum period, especially if you have those risk factors that I have mentioned. So please take note of this. What is the difference of baby blues from peripartum depression? Okay, so we now go to the characteristics of those person who actually experiences postpartum psychosis. Okay, we have actually clinical features, and the onset is acute within 2 weeks postpartum, but it can be as early as day 1. Okay, there would be poor concentration, delirium like impaired sensorium, orientation. So, hindi ka aware kung saan ka, sino yung kasama mo, or anong oras na, anong araw na. Okay, rule out organic causes. Of course, we actually have to rule out, no? Baka may organic cause like imbalances of electrolytes and other metabolic causes. Okay, yung behavior, agitated, no, hindi mapakali, parang restless talaga, hyperactive, emotional distance or coldness. Okay, yung mood na elated, pwedeng labile, so pwedeng always change yung mood, dysphoric or less frequently depressed. Okay, yung affect niyan, yung ma-observe mo, flat siya, parang iba yung reaction niya, or wala siyang reaction, no? Or incongruent. Okay, rambling yung speech niya, okay, insomnia, very common din yung insomnia, hindi makatulog. Okay, very important for person na on postpartum na makasleep siya, especially if hindi na siya nakasleep all throughout the night, which I actually experienced during a postpartum period of few months ng mga dalawa kong babies, no? So, prioritize talaga yung sleep ng mother, okay? Daytime, please help po ng mga family members. Let the postpartum person at your house, no? Yung mother sa bahay niyo na makasleep siya. So, back tayo sa mga features, no? Thought content, no? Mood incongruent delusions, thought broadcasting, ideas of reference, nakala niya other people are talking about him or her, her, of course. Infant being harmed or killed, no? Persecutory, may mga wahabol or may gustong pumatay, no? Someone who wants to kill her. Jealousy, no, iba, no? Before kalma lang, ngayon very jealous na sa husband. Of being yung being controlled, mood congruent delusion of grandiosity, no? Yung delusion is fixed false belief. She believes in something na kahit hindi naman fact. Okay, siya lang yung fixated sa ganung thought. Disorganized, flight of ideas, okay, yung how she behaves, then may mga hallucination, she can actually see things or hear things or mga boses or voices. Imagine yun. Like organic leg, visual, olfactory, no? She can smell things na hindi naman present. Okay, tactile, commanding auditory. So, very important din if command hallucination, no? Yung gustong mag-control sa kanya. Okay, there are also 5% na may suicide or very important kasi yung mental health, especially na if during postpartum period, kasi hindi lang yung mother ang at risk, no? Pati na yung baby. Okay, so very important talaga to know postpartum psychosis, and also postpartum depression. So, okay, if you learned from this video, please like and share. God bless.